Inequality and discrimination are unfortunately systemic in American healthcare and surgery. And while much has been written and researched about how that manifests along lines of race and sex, there's been virtually no scholarship on issues of LGBT inequality and discrimination in surgery. Our team used a multidisciplinary approach of historical and legal scholarship, as well as traditional literature review, to define the scope of LGBT inequality in surgery. We found that from the beginning of the definitions of sex and sexuality in this country, healthcare institutions played a large role in both defining those terms and enacting inequality along those lines. And from that historical trend, we have the present, where LGBT patients within surgery have higher rates of certain diseases and worse outcomes along a spectrum of pathology. As well, LGBT providers face specific abuse and discrimination from their patients and from their colleagues that leads to severe personal and professional harm. We as well look specifically at the institutions of the US military as well as religious hospitals in this country, both because of how ubiquitous they are becoming, but also the specific issues they provide for both patients and for providers. Finally, we discuss ongoing DEI, or diversity, equity, and inclusion initiatives, and how they can serve as a model and framework for promoting LGBT equity in surgery. This research is, of course, not all-consuming or the end of research for LGBT issues in surgery, but hopefully the start of an ongoing conversation.